Hello, this is Dr. Do again. This video is on alphabetic list of problems. Today I'm going to talk about very common hypertension, and I have talked before. If you follow up my streams, streaming videos on the quarantine special, I talk about the hypertension, the fundamental. But today I'm going to talk about hypertension. It probably just start from the explanation of what is hypertension and what is the worst complications in terms of the lifestyle modification and how to manage to follow your physician's guidance and comply with your physicians. So this is kind of probably additional to the previous video. This is probably just some extra information. So basically, let's start from the any emergency situation associated with the hypertension. Yes, the worst, actually the dangerous complications of hypertension, long-term elevated blood pressure could cause the blood vessel wall getting thin, and especially in the brain. So if that's the case, then stroke, hemorrhagic stroke, it's the dangerous and quite common complications, particularly for those who had the pre-existing abnormality of blood vessels in the brain. So hypertension really increased risk for this hemorrhagic stroke. And the other complication is heart failure. Of course, stroke is the emergency situation. You need to see your physician as soon as possible. If you notice any severe headache or neurological deficit, cannot move your arms, lost sensation, even lost consciousness. So these are the signs really for emergency. The other complication is heart failure. Usually heart failure is not acute, it's just a long-term build-up. But acute heart failure could be very dangerous. Suddenly developed the arrhythmia and also edema and fluid back in the lung, feel gasping air and lack of oxygen, shortness of breath. So these are all the signs that you need to, if you know you have hypertension history and these signs suddenly develop, then you need to see the emergency as soon as possible. So let me just explain what is the blood pressure before we talk about the hypertension. Oh, by the way, is there any hypertension that you can manage at home? Probably the pre-hypertension, your blood pressure is borderline. You can start with the lifestyle modification, lose weight and exercise and eating healthy diet. Usually, I think it could be helpful to lower the blood pressure, but eventually I think high blood pressure is just the rod for the result, the consequences. So you need to monitor with your physician, really managed by the physician, by medication. So this is the two-end, emergency or home management. What is the blood pressure? Let's start from what is the blood pressure. Blood pressure is to measure the tension, the resistance from the peripheral blood vessels to the heart. So along with when the heart contracts or when the heart dilates. So that's systolic or diastolic blood pressure. So the meaning for this is really to measure, first of all, the blood vessel wall, whether it's stiff, sclerotic, or lack of flexibility. So that's one of the cause, because especially the dilated blood pressure, if it is not low, that means your blood vessel lost the flexibility. That's one of the cause. So this is the measurement of this blood pressure. And if you imagine the heart, I think I have mentioned this before, the heart consistently to work harder to overcome this elevated blood pressure. So that's really as extra burden to the heart. So that's one of the mechanisms cause the heart failure, because the heart is exhausted. And also the long term of this kind of hypertension change the blood vessel wall, undergoing the sclerotic inflammation and become thinner. It's just like a balloon, so that's the aneurysm developed. So that's the risk for the hemorrhage. So these are the explanation for high blood pressure, the eventual consequence. And talk about that, we talk about the end organ damage. I think I mentioned it before. The most important, the most significant are the retina, the eyes, and also the kidney. We talk about the brain and also the heart. And the hypertension-related retinopathy is quite common. It could be very dangerous, losing sight, because of this abnormal blood vessel. So this is the mechanism. I think I mentioned before, the retina got the message because of the blood pressure is high, cannot get enough perfuse of the eye. So the message is, I need more blood supply. So then the retina grow a lot of new blood vessels, or the blood vessels undergoing changes like microaneurysm. So these are all kind of abnormalities tend to cause the bleeding. And this kind of bleeding usually a little deeper and flame-shaped. So this is about the retinopathy. And kidney is another organ that really is susceptible to the hypertension damage, because kidney, the blood vessel in the kidney and glomerula are the small globe of the blood vessels. So if the blood pressure is high, blood vessel those blood vessels start undergoing ischemic damage, really cause the parenchyma damage of the kidney tissue, which means loss of the functional glomeruli. So that's very severe and quite common. So this is the hypertension. Start from fundamental mechanism of what is that refers to and what kind of end stage. Now talk about the management. I think the earlier the better. If you usually it's found during the regular examination, find your blood pressure. So hypertension defined is not like you measure once, the blood pressure is high and you're diagnosed as hypertension. Usually it has to be, there's a criteria. You have to be in the relaxed situation, not under stress, no white coat syndrome, and also rest after you arrived in the clinic and measure 3 times, make sure, and a week of each measurement. That's the textbook, but practically probably not that useful, but still it's at least 2 or 3 times measurement consistent your high blood pressure, and then make the diagnosis. So at the beginning, your physician may just saying lifestyle modification, but however, if you have family history, if you have other risk factors, probably start medications. In terms of medications, you probably, if you have hypertension, you probably know it. There are different classes, different categories, working on different mechanisms, but the final purpose is to lower the heart rate, lower the blood pressure, so to decrease the burden of heart. That's the principle of managing high blood pressure, is to preserve the heart function as long as possible, as much as possible. For example, beta blocker, to decrease heart rate, so then the heart not working so hard. Give enough time to dilate, to relax, and to refill the blood, so then the heart doesn't need to work constantly working hard. So this is really deferred the heart failure development. This is just one example. Other medications serve the same idea. But regardless, there are so many variety of hypertension medications: beta blocker, calcium channel blocker, ACE inhibitor, and ARBs. You know that if you have hypertension. So follow your different physician has different preference, and also different people react to response to the medication differently. For example, the African American respond well with the diuretics, and some other group respond well with the beta blocker or ACE inhibitors. So these are your physician's preference and also the fundamental guideline to manage. The point is you need to follow up with your physician and know the worst scenario, the worst complication, and also how to slow the progress of this hypertension, how to lower it and consistently maintain at a healthy level. So that is the key for managing hypertension. I think I'm going to stop here. I hope it helps. You probably already know it. If you know it, then this is just serve as a reminder. If you do not know, then I'm glad that I can bring this information and to help you. Thank you for watching. I will see you next time.